Nice to be here today. I'm Dr. Sara Morgan. I'm Associate Professor of Public Health at Wessex at the University of Southampton. And I'm here to present with Emma and Steph. I think Emma is the expert in CARA. She is a Service Development Manager at Southampton Trust, who is a lead service provider. And so...
Not a doctor.
Still, very close. Steph, who is the PI for our qualitative work, who's actually stepping in for our research associate who had a momentary lapse this morning and thought it was tomorrow. So bless you, Steph. But she has been overseeing the qualitative work, so no doubt we'll be able to answer all our questions. So I'm going to hand over to Emma, I think, now to talk about CARA.
Thank you. Yeah, so I'm just going to talk a little bit about some of the background that's informed the development of this intervention, actually about a decade ago. So we know that domestic abuse is prevalent across the UK, and the crime rates aren't really going down. In fact, over the period of COVID, they went up. So what we're looking at not only is an increase in terms of the reports in crime, but also the impact, so the adversity package of poor health and social outcomes, such as alcohol misuse and poor reproductive health, just to name a few. I think we could probably spend all day just talking about the adverse health impacts as a result. Vulnerability to domestic abuse is also associated with low income, economic strain, and benefit receipt. So we're seeing sort of multiple disadvantages and challenges along the way. So what we're seeing is a need and a gap in terms of early intervention. So that was the background that CARA was developed. So what is CARA? CARA, I should probably explain, the acronym is Cautioning and Relationship Abuse. So it's an early intervention that sits in the criminal justice system, which means that it's following police involvement only. It's an out-of-court disposal as an alternative to a simple caution or prosecution. So what that means is when there is an arrest for domestic abuse and it meets a certain criteria, so risk level and the offender profile, so not a history of offending behavior, not more sort of complex needs that go along with either the offender or the victim, then they meet the threshold to look at what will help apart from a simple caution or the case being no further action. So a simple caution was what existed before and still exists in a lot of force areas, which is essentially a slap on the wrist. It's a warning by the police and then off you go, which obviously doesn't really do much and obviously leaves victims who are often the ones reporting the crime or needing to speak with the police a lack of opportunity to move forward. I'm gonna move quicker, aren't I? Yeah. So it's a simple caution, it's a replacement for a simple caution or prosecution, or in real terms, no further action, for lower risk, alleged first-time domestic violence and abuse offenders. It consists of domestic abuse awareness-raising workshops that support opportunities for self-disclosure, self-reflection, and promoting access to additional support. Looking at what services are available locally and also what's going on for that individual that might help them connect to, including longer-term behavioural change programs for perpetrators where possible. So the offenders attend 2 workshops. They're 4 to 5 weeks apart, which is a design part of CARA. It provides that opportunity for reflection. And also, as mentioned below, time for a linked victim contact, which gives additional opportunity for partners and ex-partners to be offered signposting, safeguarding, and support. They are given a 16-week time frame to complete the intervention by, and that is built into part of the caution that the police issue to them. So, why CARA? So what we saw initially as CARA was developed is that we're seeing a lot of cases and have seen and continue to see a lot of cases where we're seeing repeat reoffending, lots of domestic violence and abuse cases that come to the attention of the police, resulting in no further action. They don't meet the threshold for charging or prosecution, and the only option is essentially court. And we know that there are obviously multiple disadvantages to victims being able to sort of carry on through court, and obviously that's even if it meets the threshold for police evidence to prosecute. So this goes alongside that reoffending rate all the way through. So the police disposal option in place of simple caution, because simple cautions essentially fail to offer any sort of rehabilitation to the offender. Risk isn't effectively managed, and in fact, there's no opportunity even for the offender to reflect on the impact of their offence. And the safeguarding and support that's provided through the victim contact, as well as clear guidance that we offer to police and the service providers, ensure CARA remains safe and effective as an intervention. And we can see from an individual, I think this is from Gary actually, one of the individuals that has completed an interview mentioned that he had a history when he was younger of being in and out of prison, and no one tried to get to the root of the problem. And I think that remains a gap in terms of offender intervention. I think that's...
Brilliant, thank you.
Oh, no, you have.
I've got one.
Yep.
I'm live. So just to give you background of where we are evaluating CARA. So we have 9 police forces that are currently operating CARA across England and Wales. And alongside that, we are together, there are 5, I can't count, ARCs that are involved in this project. So essentially what we're doing is we are doing a mixed methods study. So we're doing a national multi-site evaluation of the project CARA, which has never been undertaken before. There's been a pilot done within Hampshire, but certainly since it's gone national, or supernova as they say, it hasn't been evaluated. So we're using realist principles to examine its impact on type and severity and harm to survivors and their family. So how do we do this? Well, we're using routine data. So we're doing a mixed method study of police data as well as qualitative, which is going to be a longitudinal study across 2 time points, which Steph will talk to shortly. So the quantitative methodology, we're looking at across all 9 police forces, extracting their data to look at sort of trends over time, using what we call interrupted time series analysis to look at how the interruption, which is the implementation of CARA, might have influenced the outcome, which is the incidence of domestic violence and abuse over time. And alongside this, we'll be conducting a longitudinal qualitative study, which is using interpretive phenomenological analysis and reflective thematic analysis. And that is to work with what we call the kind of all stakeholders involved in CARA. So that would include the police, those that are delivering CARA, as well as workshop attendees and survivors. And over to Steph.
Rather helpfully. Is that on? Yeah, rather helpfully. I haven't got very long left. So I'm not Gary. I'm going to do my best to perform as Gary. So the qualitative study is really important because, as Sara indicated, the last national evaluations were pretty much entirely quantitative. Mm-hmm. So there's quite a large qualitative arm to this study, which involves interviews with police leads, one-off interviews, but then a longitudinal study at 2 time points with workshop attendees and victims. And then finally, focus groups at the end with professional stakeholders. So CARA facilitators, voluntary sector organisations that all work to support perpetrators, for want of a better word, and victims. So, do I just press down? Is it down?
Right,
yeah. Aha. So these are very, very, very early findings. We're in the middle of data collection at the moment. So we have spoken to 10 police leads, which I believe covers all of the police leads that are involved in the delivery of CARA, which is fantastic. And so far we've spoken to 13 workshop attendees. So just in terms of some early findings, I don't think I've been involved in the evaluation of an intervention that at first glance has such a universally positive articulation. Everybody was positive in terms of the police leads. However, what we are finding is that there were logistical challenges, particularly for small forces, and that CARA is being implemented differently in different force areas. So we're hoping to unpick that a little bit more. There was a wish to increase the use of CARA. It's seen as quite an effective intervention that reduces workload. And there is some want and some scope from police leads to widen the eligibility in terms of the risk threshold for being eligible for CARA. And then in terms of workshop attendees, we also had a positive response from workshop attendees. I don't know the exact numbers, but they are predominantly male, which reflects what we know about prevalence of domestic violence, but there are a couple of female offenders in there. They believed that it gave them an increased understanding of why problems had occurred, and that the sort of the forced options, as both Emma and Sara indicated, of court might have impacted attendee engagement. And they expressed that it had resulted in a change of approach to other relationships in their lives, so for example, relationships with children. I think it's important to reflect that this is interview 1 of 2. Okay, so what we're really hoping to think about is that in 6 months' time, do any of the measures and the messages from CARA still resonate? And then just to kind of put a bit of context to that, I'm always happy to put a bit of context. So the quote from the left-hand side is from a male workshop attendee. At the end of the first day, I went and sat on a bench and had about an hour's reflection and a little cry. And then the quotes on the right-hand side, I believe, are from police leads. So, for instance, the one at the bottom, most of the referrals to CARA are cases where the victim just does not want to go to court, but they want the abuse to stop. Is this you?
Yep. Yeah, that's it. And that's just to say thanks to all our collaborators involved and the police forces. I think that is it.